Hello and welcome to Threefold Herbal Healing. I'm herbalist Leo today. I help people who struggle with chronic conditions, sometimes for a long period of time, grow their health from the roots up. Today I wanted to speak to you about NSAIDs. Those are those medicines that are sold off the counter and found in almost everybody's medicine cabinets. Raise your hands if you don't have NSAIDs in your home. We reach out to them for almost any ache and pain, from the simple headache to toothache, back pain, fever. We use NSAIDs. The packaging comes with a note, a long one, that includes all the side effects. But if you are really honest with yourself, you never read it. On the other end, the writing is so tiny that it's not really meant for you to read it. So cut yourself a slack. Because NSAID are so commonly used, and because I want to inspire you and my clients to make informed decisions before they are taking anything into their body or making any life choices that affect their bodies, I decided to tackle the topic of NSAIDs, their pros and their cons. So it's going to be a little bit nerdy, a lot of science information. But don't worry about it. You can do it. I trust you. It's important you understand what happens when you put those medications into their body. And it's not that I am against them, but we need to make an informed decision of when they are going to benefit us best. So, what really are NSAIDs? NSAID stands for non-steroidal anti-inflammatory drugs. They are the most prescribed and off-the-counter used medicine in America. So you might recognize some of the brands like aspirin, ibuprofen, Advil, Motrin, and Aleve. All of them are like everybody uses them. NSAID work by blocking the production of COX enzyme, an enzyme that builds prostaglandins. Again, a lot of nerdy information. A type of immune messenger. That it reduces inflammation, it reduces pain, and it reduces fever. So let's talk a little bit about inflammation and what is inflammation is doing in your body. Inflammation is actually an adaptive immune system response to tissue damage and infection. When cells sense tissue damage, they send immune messengers that trigger an immune response. The immune response include symptoms like redness because the capillaries are dilated and they let blood leak out of the blood vessels into the damaged or infected area because blood then carries their nutrient and white blood cells to start the cleanup and remove debris and waste product. At the same time, and that cause all this redness. And the excess fluids also cause swelling. So you get a lot of redness and swelling where you have an injury. Now this area that is injured and it's now trying to clean itself and remove pathogens and remove debris, spend a lot of energy doing it. So metabolic rate in the area goes up. There is heat created. So if you touch a place that is injured, that is inflamed on your body, you will feel the heat. So it's red, it's swollen, it's warm. And also your sensitivity to pain in that area is increased. And all those fluids are pressing on nerves, which increase pain. So you have redness, swelling, heat, and pain as the hallmark of inflammation. But remember that inflammation is the body's healthy, functional response to tissue damage. It is actually the way the body heals itself. So let's talk a little bit about the physiology of it. what's happening behind the scene, because you can only understand how NSAID work if you understand what happens without the NSAID. So the member of each body cell is built out of two layers of phospholipids. So phosphorus with lipids, with fats. When a cell gets injured or infected, it releases some of those lipids from its membranes and form eikonosites. Eikonosites are like the neighborhood alarm system. They informed other cells in the neighborhood that an alarming event happened, so they can better get ready to protect themselves and the entire neighborhood. The lipid that released by the cells are called arachidonic acids. Arachidonic acids is then modify themselves and create two enzymes. One enzyme is called COX and the other enzyme is called LOX. And NSAIDs block COX enzymes. So they block this part of the inflammatory response that protect the neighborhood. COX enzyme is produced in inflammation. And really to understand NSAID and how they work, you need to understand what COX enzyme do. So we have two types of COX enzyme, COX-1 and COX-2. How creative is that? COX-1 enzyme has protective role in the body. So you might want to think about them as your housekeeping personnel. They make sure that everything runs totally smoothly. So something that they do is, for example, they build a protective mucus layer around the gut. So it helps protect the walls of the gut from the acids that digest your food, so you don't get burns on the walls of the gut, but also from the food itself, because all those pieces of food are bumping into the walls and can create tissue damage. So you have this layer of mucus that protect the guts, and COX-1 is the enzyme that kind of initiate this mucus production. The other thing it does, it's allow blood platelets to stick together. So it's basically responsible for blood clotting in injuries. So what happens when NSAIDs inhibit COX-1 enzymes? You reduce your protective layer in your gut, in your digestive system, and you increase the risk of ulcers and of inflammation in your gut, because you get irritated when you don't have enough mucus, you get tissue irritation in the gut. The other thing that has happened is your ability to clot blood over wounds, over tissue damage is compromised. So if you consider taking NSAID for pain after surgery to reduce the pain, you want to keep in mind that you are reducing the body's way to stitch itself. NSAID might not be the right medicine to go for after surgery, so maybe consider another painkiller and not NSAID, or consider how long you would like to use the NSAID, or if the pain is not so bad and you can just live with it. I'm not saying you have to live with really bad pain. I'm saying that you want to check out how much you need it and not use it before you really need it. What about COX-2 enzyme? COX-2 enzyme is if COX-1 is your housekeeping, COX-2 is the emergency call. It's function as your police and your firefighter department, but it's not the one that shut the fire, it's also the one that built fire in your body. So it's the enzyme that actually build your inflammation. Remember, inflammation, functional, healthy, adaptive response. How does it? It recruits the body to produce really everything that we talked about: the redness, the swelling, the heat, the pain. That's what COX-2 does. And it produces messengers that dial up body temperature, like fever. So when you have all those infection response symptoms, like the fever, the chills, you know, the aches and pains, the heat, the, you know, all of it that come with the flu, that's COX-2. And when you take NSAID, you kind of shut those responses. That's what you want. That's why you use it like that. But that inflammation, those symptoms, are the actual symptoms of the body fighting the pathogen. So you're kind of tripping your own body. You are taking away from the body its immune response, its adaptive healing response. So keep that in mind, and we will talk about it in a moment. When you inhibit COX-2 enzyme, what does it mean? It means that you don't have the alarm bells, so you don't know that something is going wrong. You don't know that there is tissue damage. You don't know that you have inflammation because you don't get this alarm bell of heat, redness, pain. You don't know anything. And you take from the body its adaptive response, like I said. There is one more side effect of NSAIDs, and that's about the locks. Because when you block all the COX pathways, your body is left with all these arachidonic acids, meaning it will produce more LOX enzyme because it has all this arachidonic acid. It doesn't know what to do with it. It will produce LOX enzyme. So what does LOX enzyme do? LOX enzyme produce leukotrienes, and leukotrienes are another type of immune messengers that increase mucus production. You create more mucus and more inflammation in the airways, so in the lungs, in the sinuses, congestion, all of that. That might lead to constriction, and in some cases, asthma and allergic reaction. So if you frequently close COX enzyme pathway, you will promote LOX enzyme pathway, which will eventually lead to seasonal allergies, food allergies, and asthma. So frequent use of NSAID leads to allergies and asthma. COX and LOX enzyme do not just promote inflammation, they also reverse inflammation, or they bring the entire crisis into completion. If you had inflammation, the body healed itself, and now the body is cleaning the place, the tissue is built, everything can go for normal. You want to shut the inflammatory response. It's returned to harmony. When COX is blocked by NSAID, LOX enzyme can still initiate the anti-inflammatory response and process and kind of close the event, but with less efficiency. And when they do it with less efficiency, you might still have ambers sizzling down there, untreated, and kind of the event is not totally closed. Sizzling ambers um, sustain low-grade inflammation is damaging to the system. So, like with any decision, there is always a price to pay. I'm not suggesting you never use NSAIDs, but make an informed decision and consider when they will provide the most benefits for the minor side effects. You can take this information and discuss it with your PCP if you are going for a surgery or you are going to, pull out a tooth or whatever, that you know that you are going to need NSAIDs, but you also can make your own informed decision. So I wouldn't use NSAID more than a couple of days in a row. Like if you are sick and you want to use them for 2, 3 days, that's fine. But frequent use over a long period of time, that's not something I would recommend. If you have an acute disease, you have a flu, and you feel uncomfortable and having difficulty resting, when you have a flu or you have a cold, one of the most important things to do is rest. If you really feel uncomfortable and you can't rest, use NSAID. Let your body get the rest it needs to heal. But again, not more than 2, 3 days. You want to avoid NSAID if you have asthma, if you are have like a lot of seasonal allergy, a lot of food allergies. Really not good for you. It's really not good for your guts. You want to stay away from them, and you want to consider what you can do after a surgery that is not NSAID. If you are using NSAID, bone broth and emulsant herbs like licorice, plantain, marshmallow can help restore the gut barrier and the mucus there while you're using NSAIDs. Just remember that my videos are educational. They are not for you as a way to diagnose yourself or recommend a treatment. Bear in mind, this is educational. This is for you to learn and make informed decisions. Thank you for taking the time to watch. I hope it was beneficial. If you have any question or comment, please leave them under the video. Have a good day. See you next week when I will be speaking about antihistamines. See you then. Bye.